Welcome to COVID Conversations, where we discuss the latest COVID-19 news with the experts. The number of Americans receiving COVID-19 vaccines grows, but many are still skeptical about their safety, their effectiveness, their long-term impact. False or misleading information has also built distrust in the vaccines. Shunda McGahee is the medical director of Ambulatory and Community Services for Beth Lahey Health Behavioral Services. She joins me now. Dr. McGahee, welcome.
Thank you. Glad to be here.
Today's question is, how can people have meaningful conversations with loved ones who are skeptical about receiving the COVID-19 vaccine?
I think that is probably one of the most important questions that I talk to my patients about. If people are concerned, people meaning people like me, people who look like me, am I being experimented on? Am I being tested? Can I trust this vaccine? The very, 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 very first people to get the vaccine were healthcare providers, doctors, nurses, respiratory therapists, receptionists, admins that are in health systems. And we are the people that patients, the communities can look at to say, did they die? Did they have bad effects? Did they fall out? Did eyeballs come out? Did scales grow on their neck? And I think that we are the ones that really determine and will report side effects. So if there's a complication, if there's something to be worried about, we as a medical community would be the frontline people to say, this happened to us and this is our concern. The next thing that I talk to patients about is just not necessarily their own health, which is important, but the health of the need of the people around them for them to be healthy. So if I get sick, that affects my spouse, that affects my parents, that affects my nieces and nephews, my ability to engage in my work. And so it's less, if I get sick and nothing is affected, that's one thing, but my wellness actually affects the larger community. And so that's another motivating reason around determining whether you should or shouldn't get the injection. And particularly communities of color, which I have a very strong affinity for as I'm a part of a community of color, and thinking, how am I pitching in to my community? How am I demonstrating safety to my neighbors on the left side of me, on the right side of me, who live above me in the condo or below me? It really is almost kind of a public service, I think, in getting vaccinated. And the data that we have at this point for a life-threatening illness that has killed more Americans this year than anything that we know of, it's pretty important. It's pretty important, unequivocally important.
And that it's killed Black and brown Americans at a disproportionate rate, that they're being infected at a disproportionate rate, but then also have a distrust and a distrust that should be understood and comprehended of the medical field. So it's just a very complicated relationship, I'm sure, to let them know that you have every right to be concerned. You have every right to potentially not trust, this process, but for your health and your safety, we have to look at all of the benefits and the risks together.
Absolutely. Absolutely. And this is one of these cases where the medicine is not being tested on you first. We're not gathering up all of the Black and brown people and saying, we have this thing that we want you to do. Healthcare providers were the first. So by the time it gets to people in other communities, that means millions and millions and millions and millions of other people have had this injection before it gets to you. You who actually need it the most, more than anyone, you who need it the most, it's been thoroughly vetted at that point because so many other people have gotten it before you. And I highly, highly, highly encourage anyone who has any doubt to consider, what would happen to my family if I weren't here? What would happen to my family if I couldn't work? What would happen to my family if I got sick and they got sick? And so I just think that those are really pertinent questions in this day and age and time, and that the safety of the vaccine has been vetted. Millions and millions and millions have received the vaccine, not only in this country, but across the world. And there's a time for suspicion, and there's a time for action. And right now, we're really in a time for action.
I probably could speak with you all day, Dr. McGahee, and I really appreciate your time. I think that that's extremely valuable for people to consider when they're having these conversations with the people that they love and in their community. Thank you so much for coming on to take the time and speak with me about this really important topic. I really appreciate it.
Thank you for having me. This has been great.
This is COVID Conversations, where we discuss the latest COVID-19 news with the experts. Thank you so much.